Hello, good morning, good afternoon, good evening, whenever you are checking us out. Greetings from the Richard Watkins Podcast. I'm Richard Watkins, your host, and we are very excited to have a very amazing guest with us today. Before we introduce our guest, I first want to say huge shout out to the Science Policy Action Network, or SPAN. They make this podcast possible. Check out SPAN, your partners in thought, leaders in innovation, at span-inc.org. That is span-inc.org. All right, so we have got with us Alonza Pamplin. I'm so excited to have her with us today because we haven't had an opportunity to have a topic of public health. And I've known Alonza for maybe about, I don't know, 13, 15 years now. I think
Hmm.
the first time I met you was at Amir Lauren's wedding. And
Yep.
then later, maybe 5 years later in Seattle at Abercam's ABR
Mhm.
CMS, right? Um, so, yeah, go ahead and introduce yourself. Where are you at now? And yeah, welcome to the Richard Watkins Podcast, Alonzo.
Thank you so much for having me. I'm Alonza Pamplin. I'm currently working as a consultant at UNC Health. I'm focusing on community health and engagement. And I've also recently graduated with my master's in public administration from North Carolina Central University this past December 2024.
Congratulations, congratulations. So, going all the way back, rewinding the clock a little bit, when I had a chance to meet you in Seattle, where were you at that time in your educational career? You were an undergraduate student. Where at that time?
Mhm. So at that time, I was a second time undergrad student, getting a second bachelor's. I was a student in the public health education department at Central. And at that time, I was part of the Partners Fellowship. So it was a cancer research fellowship that was in collaboration with North Carolina Central and UNC Chapel Hill. And so we were able to spend time at Carolina with some of their professors, working on different research projects over the summer, professional development, those type of things. And through that program, I was able to pay for that second bachelor's degree, as well as have the opportunity to present at the Abrams conference. So yeah, I had got my first bachelor's from Howard, graduated in 2012, and it was in psychology. I wasn't really prepared at all. Not even I was not prepared at all to go to graduate school, but that's because I was enjoying living in DC, going to Howard. It was like, look, I graduated in 4 years. I did enough, but the grades were not there. Like I C's get degrees. That was my motto back then. I'm much older now and I know better when you're paying for degrees out of pocket. So if you have a scholarship or if you are paying out of pocket for anything regarding your education, it is an investment, so strive to get a great GPA. Do not get caught up in the fun. The fun will be there. But yeah, so I needed to boost my GPA. I signed up to take those undergrad classes at Central. I was taking one graduate class at that time, plus the public health courses. And a professor there, Dr. Reed, shout out to her. She's also a public health trailblazer herself. And she got me interested in public health. She introduced me to the Partners Fellowship. And she was like, look, if you get into public health, you can work straight after, this degree, and you'll get the field work you need to do more as far as an advanced education. I was like, okay, cool. You said I can work with this degree in my field. So that's what I did. And yeah, I graduated from Central, and then I went straight into my first job. Graduated in May, started my next job in April.
I don't know how you felt about ABR CMS. By the way, I actually don't. I used to call it Abercams all the time, and then I started hearing people call it ABR CMS. Yeah, what did you think about that? Like, I mean, I'm just gonna reflecting back. So I was at Fayetteville State when I went, and at that time in my life, that was one of the best times I've ever had. I mean, to that point, I had never seen, there's so many like beautiful people who were like the smartest that you could find, like all trying to like get ahead. Like you really felt like that energy. I mean, I know when I saw you there, you were like, all right, I'm gonna practice even more for my poster presentation. So you've got like the nerves at the conference because you want to do well, but also there's just so many amazing people there. Like, I don't know, that was just a really cool experience. The first time I went, which was in Anaheim, which was right down the street from Disneyland. So that was pretty incredible. Yeah, what about you? What about your experience? Did you enjoy it, or was it like you're like 100% focused professionally? Was there any fun sprinkled into your Abercam's journey?
Absolutely. When you go to Howard, you're gonna see somebody from Howard everywhere you go. So I actually knew someone who went to school with me, and they actually worked at the convention center. So they were actually able to show me around Seattle, which was a plus. It was a beautiful city, and on top of that, I just had such a great time. I love a good conference because not only do you get to gain expertise in your area, but you also meet so many people doing other things. And it was a lot of college students there as well. So it was an opportunity to meet people who could mentor you and people who have the experience that you're hoping to gain one day, but also other people who are in your same shoes who may be facing the same type of bumps in the road that you're facing as a college student. So I really appreciate that we got that opportunity to go. And I think that one thing that students should always do is be able to attend at least one conference, whether it's a local conference, something in your state or something out of state. When Christmas time comes up, and you've got enough stuff. I'm one of those people. I've learned you've got enough stuff. So one thing might be like, hey, like, look, family, I need $300 for this conference. I need 200 on a hotel, and I need a flight. Like, get and then get in organizations. There's organizations in the fellowship that I had as well that will help you pay or cover all of the costs for these things. So I feel like going to that conference was just amazing. Also, the MTEP students from Morehouse School of Medicine, that summer program, they were there. So I was able to connect with students who I had met a year or two before. And it's actually been like that at several other conferences, these college programs where you end up seeing other students in your field or who are field adjacent at more conferences.
Yeah, we really need a statewide undergraduate conference. That would be incredible. Like a statewide
Mhm.
undergraduate conference. So you wouldn't have to, I mean, of course, go to Seattle, go to Houston, go to wherever these incredible conferences. But I think a statewide would be great, save money on traveling. But I remember, I know you said you had a good time, but when I stumbled upon you, you were in an empty conference room practicing that presentation. Like, meanwhile, like all one, I don't know how many people were there. I don't know, like 15,000 people, right? Everyone else was out having a good time, but you were in that conference room preparing. And I was like, okay, this person is going to, shake the world wherever they are going. And you ended up going into public health. I ended up running into you several times when I need something in the public health space. And I mean, you've been absolutely incredible. No matter what I need, I call you and you're like, oh yeah, I got the person you should talk to, or I got so let's start there. Public health. Why public health? Why did you decide out of all the things that you can apply your talent and skill to, why did you decide to go in public health?
So I learned about public health when I got to Central, like exactly what it was, what it encompasses. You've got community health, you've got environmental, you've got just industrial. You got so many other things that goes into public health, epidemiology, of course. So that's why I really learned what it was. And that kept me on the path there, learning the different fields. But far as being a public health practitioner and staying in this because it's a passion of mine, just comes from my family. I'm from a health background focused family. My grandmother, she was a nurse. She retired as a nurse. I have several aunts and stuff that I've are nurses as well. But my grandmother sharing her stories with me is what really got me into things. I wanted to be a doctor, then I went to college and I took that biology class. First semester freshman year at 8 a.m. Do not do it. Just don't do it. And
It's too early for the Krebs cycle and glycolysis. It's way too early for
it's
that.
it's just too much. It's too much. And you're running on fumes because you have to cook for yourself. And you actually don't have a stove. So you're probably running on noodles. Okay. So just don't do it. And so I took that class in the science. I was like, you know what? I don't think that becoming a brain surgeon is, I'm not gonna be dedicated to that like I should. But I knew I wanted to work in
You
healthcare. I
wanted
knew
to be
I
a
wanted,
brain surgeon?
yeah.
Is that what you wanted? Okay, I didn't know what kind of doctor, but you wanted to be a brain surgeon. That's what's up. Okay,
Yes,
all right,
and
I didn't know
now I
that.
have like the worst carpal tunnel and everything, so
Oh, you
it
messed
worked out.
somebody up. If they were on your table, they better say
Yeah,
they
I be there
prayers.
shaking, so it worked out good. It
You
worked
were
out really
not good at
good.
the game operation, right?
No, not at
I'm
all.
sorry.
But it worked out perfect though. And so she would be telling me these stories, and then I also had two uncles who were HIV positive. And the more that I looked into the disease, because I'm the type of person that if I'm watching a TV show, I'm Googling the characters, I'm finding out all this stuff about them. Like I'm into it. I like documentaries and investigating and stuff. So heard HIV, heard what it was as far as their stories. One of my uncles, which was my grandfather's brother, he refused treatment when it first came out. As we know now, there were so many bad side effects when people first started taking AZT. So a lot of people refused, and unfortunately, they did not, survive AIDS back then. So a lot of people passed away. But then my grandmother's brother, she was a nurse at Duke, so she worked on getting him into a research study. And when he got into that study, he received his meds for free. He lived a healthy life for the most part. He passed away from throat cancer, but he never developed AIDS. So his CD4 count and his viral load were never indicative of him having
Wait,
AIDS.
back up a little bit, because you're dropping gems here, and I know we might take for granted HIV has been around for a long time. It's interesting to hear you tell your story because um, I'm a virologist, but the virus that really brought me into virology is HIV, and that was my dissertation work. But back all the way up, just for just brevity, right? Let's just recap. So HIV is a virus. You mentioned CD4, you mentioned T cells, viral load. Why are you mentioning viral load and why are you mentioning T cells? Why is that useful for people to know in regards to understanding virus and ultimately the disease it causes?
I think it's important for people to understand these terms and know what they mean, because there's so many terms when it comes to it. And one term that people are hearing more and more is being undetectable or not having like a high viral load. So when somebody's undetectable, they are considered untransmittable. So when someone is undetectable, that means that their viral load is a very low number to where they do not have enough of the virus in those bodily fluids to infect their partner. And it means that they also have a good healthy T cell count or CD4 cells, which are those immune system cells. But that viral load is very, very low. So with that, we want people to understand that that's a great thing to achieve, but you also want to stay undetectable. You also want to stay untransmittable by going to your doctor, getting your labs done, and taking your meds. And I think the thing is that, you do have stigma, you do still have HIV criminalization, but a lot of people just don't understand what it's like to be positive, and how much that is a piece of encouragement and actually brings people peace when they know that they can have a healthy relationship with someone, even if they're positive. I think that brings people joy and it gives them power to continue to be on treatment or to seek out treatment again or seek treatment for the first time, knowing that they can be healthy and that their lifespan is going to be the same as someone else who's not HIV positive, So those are things when I say them, sometimes those keywords, if someone doesn't understand it, it might spark them to go look it up.
So, all right. So I don't know where to start here. So, first of all, it was just very interesting to hear how you kind of gotten into infectious diseases and studying HIV and understanding, the community's role in it, and you having family members and kind of that direct experience and exposure. I I remember first coming across the concept of HIV. I don't know if you remember, maybe you're too young, but like TLC, Don't Go Chasing Waterfalls.
Mm-hmm.
There's obviously, I think it's the second verse. I think it's the second verse where they talk about a couple and they have HIV and tragically they lost their lives. And so I felt like at that time there was a lot of conversation publicly in the community about HIV with celebrities talking about it. I don't, and correct me if I'm wrong, but I just feel like there's not as much conversation about HIV anymore. Obviously, there are
Mm-hmm.
other, pandemics and viruses that are kind of more famous or infamous now than HIV. And somebody might feel that HIV is no longer a thing or no longer a concern. Is HIV still a problem? And how bad is the problem currently?
So I just want to give a quick plug in that today is National Women and Girls HIV/AIDS Awareness Day. Um, but I'll say that the thing too is, unfortunately we're going with the times, but in the bad way. So when HIV first came out, you started seeing, ads and things about getting tested. Just like in World War II, you had lots of communication or materials that were being put out for soldiers so that when they were going overseas or they were going out the ship, they needed to be aware of syphilis and gonorrhea. So you have those same types of marketing that were being put out.
Well, a lot of you. I am so sorry to cut you. What? All right, so that's a thing. All right, so that was a big public health initiative for soldiers during World War II to be aware of infectious diseases that they may come in contact with through pamphlets and material.
Mm-hmm.
That was big right there. I didn't know I had to stop you. Continue. So just like in World War II, at the height or the beginning of HIV, there was information. Is that where you were going? Sorry
Mm-hmm.
about that.
Oh no, definitely. And if you look at those posters, it's sad because a lot of them were geared towards the women, like stay away from the fun girls, and it was, making it seem like the women were the problem. So you'll definitely have to go back and look at it. Those vintage syphilis posters, they're online if anybody wants to see them. But in the 90s, in the 2000s, you had a lot of marketing regarding safe sex. They had the BET Wrap It Up tour. That's what made me wanted to go to an HBCU because I was a little kid and I was like, my cousin and them, because they went to A&T, I was like, they probably having a good time. They out, they having the concerts and all that other stuff, but you heard about wrapping it up. So even if you were at home in high school, you were still seeing commercials about safe sex, but that environment was different from what they were actually on campus encountering. You've got the college students, the college life is a little bit different, but we still heard the message. And then I remember there being a campaign with some of the different Black actresses. I think like Free, Megan Good, some other people, they were doing a campaign that was like, you don't have to have sex to be sexy. And they were promoting, being able to say no and abstinence and those types of things. But now you don't really see that anymore. Most of the marketing has been geared to the LGBTQ community, and HIV does not discriminate. It's not just a single community. For one thing, that makes it seem like people who identify as LGBTQ are the only people who can contract HIV. And that's not fair because anyone can contract HIV. And at the same time, you're doing a disservice to other communities because they aren't seeing the marketing that looks like them. But everywhere you turn your head, you see risk behaviors. It's all in the music, it's all in TV, radio, everything has risk behaviors in it. And that is drug, alcohol use, and unsafe, unprotected sex. It's everywhere. And if you want to try to get ahead of something, you have to keep up with what's going on. If my child, these teens, if they can log online and they can have such easy access to sexual behaviors, they also need to have just as much easy access to evidence-based information so that they can make informed decisions. It's not about controlling people. This is a big thing that I want parents and caregivers to understand when it comes to youth. And when you're talking to them about being safe, they're going to do what they want to do. That's evidence. It's been proven. But it's also been proven that when you equip someone with a toolkit, right? And that toolkit is condoms, education, birth control, PrEP, and PEP are now also part of this toolkit. They are going to make informed decisions, higher rates of informed decisions, which is going to lead to less cases of HIV, STIs, and unwanted pregnancies.
PrEP, PrEP and PEP. Can you define those terms
Mhm.
for us really quick?
So PrEP is pre-exposure prophylaxis, which prevents someone from contracting HIV if they're HIV negative. It's a pill that you take once a day, just like a birth control pill or your daily vitamins. And you have to be HIV negative to take that. You could stop if you know you're in a situation where you're like, you know what, I'm not taking these risks, or I'm in a monogamous relationship. Some people stop taking it. Then things may happen in life where they start back. So you do have some room with that. Now, PEP is something that you would take after a risky event, so unprotected sex. You use protection, but the condom breaks, or sexual assault as well. That's something that you could take. You can get that through sometimes your provider or through an emergency department. Some health departments have them, but there are tools and resources online that can help you locate where you can get both PrEP, pre-exposure prophylaxis, and PEP, which is post-exposure prophylaxis. But post-exposure prophylaxis, you have to take it within 72 hours after the event. So the sooner, the better. But with those, we have these in our toolkit, but a lot of people don't know. If you are a heterosexual man and you're having unprotected sex with multiple people, or even if you're having unprotected sex with someone and you all don't have that boundary as to you all are not going to have other partners, it's not a monogamous thing. PrEP is for you. If you're someone who is using IV drugs and you're sharing needles, you're sharing works, PrEP is for you as well. And if you are a heterosexual cisgender woman, PrEP is for you as well. One thing that I saw when I was working as a DIS is when I first started working and we would interview clients, we were not seeing a lot of heterosexual transmission of HIV and syphilis. And I started in 2016. By the time I stopped working as a DIS in January of 2024, a lot of the cases that we were seeing were of heterosexual transmission. And by what I mean is the person who tested positive for HIV and or syphilis only had sex with the opposite sex, and none of the partners within that close sexual social network, which is you're my partner, this person and that person is your partner, and these are their partners, that sexual social network, no one in those social sexual networks had a partner who was a man who had sex with men or transgender women. So when you're looking at the data, when you're looking at these field interviews and the facts, you should not continue to target the LGBTQ community as if they're the only people who are transmitting and contracting HIV, when the evidence here is showing you that you're doing a disservice to people who only have sex with the opposite sex, because they're at risk as well, especially the high rates of syphilis within pregnant women. So that's something we saw too.
So if every sexual demographic is vulnerable to sexually transmitted diseases and are in need of educational resources and services and resources specifically. Did I understand that correct? Is that what you're saying? Every demographic?
Absolutely.
Yep.
Absolutely. Even older adults. One thing that we have to consider is when you have older adults and when people get older, they get in this space and the time in their life where sadly they may lose a partner, whether that be a partner that they were legally married to, or they may have been with this person for 20 or 30 years, but then they get back out there. Now, at the time, depending on where you are in your reproductive life cycle, if you're a woman, you go through menopause, can't get pregnant again, right? So you get with someone and you're not thinking about condoms because it's like, hey, I can't get pregnant. The partner is also like, okay, I don't have to worry about, pregnancy with a woman who's gone through menopause because, and this is despite the male's age, despite the partner's age, whether it's a young guy, older guy, same age, if they have a partner who's gone through menopause and cannot have children, or they have other medical reasons why they cannot conceive or carry a pregnancy, condoms are not really part of the talk, but HIV and STDs are still a risk. So you've got, communities where it's 55 and older. You have nursing homes. People are still engaging in sex. People still have a sex life, but we also have to make sure that they still have access to the things they need, whether it's routine testing, condoms, or PrEP as well. So it's not just,
Wow,
the young
that's a
folks.
wow, that is so interesting right there. Right, because you don't really think about older individuals, right? Whether they're out of a marriage for divorce or death or
Mhm.
whatever reason, but kind of like how Stellar got her groove back kind of thing. We don't really think about that being as a vulnerable group, but as you just mentioned, it absolutely is. It just feels like what you're saying is that we're missing a lot of opportunities in regards of infectious disease in public health in that regards. Now I know public health is a lot of different things. Now in regards to public health, is your primary focus infectious disease and specifically sexually transmitted disease? Is that your primary focus, or are there other diseases, other public health? Yeah, tell me a little bit about that.
So I moved from infectious disease and disease intervention. And disease intervention is basically the core of what contact tracing is, which they use for COVID. And that is you have a person who has the infection, that person has partners. So we are trying to notify, locate, offer testing and services and resources to everyone who may have been exposed to the infectious disease. So that's what disease intervention is. So I moved from that into community health. And from community health, currently what I do is I work with a community and outreach support team who will be focusing on some faith-based initiatives. I also help with the community health team that will be focused on rural health and access to healthcare in these areas across North Carolina, as well as quality improvement. I work on the community engagement side of that, making sure that we link our hospital entities to community organizations that they can partner with to provide services to their patients around North Carolina as well. So that's my job now. I went from infectious disease to community health. Outside of that, I've also done some work in the mental health space. So I did work with the I Am Brave campaign out of Charlotte, and that was also done with in collaboration with Mecklenburg County, and it was a storytelling project about mental health. And from there, I share my journey about being diagnosed with postpartum depression 5 years after having my child. Um, and I just talked about my story, just being a working mom and keeping the engine going, not realizing that, due to hormonal imbalances and just never, getting things right after having a child, my serotonin levels were just dumped. They were gone. So my body was just using up what I had. And I was just drowning. And I didn't even notice until I had a Black female doctor. And mind you, this doctor also caught that if you are having migraines, you shouldn't be taking hormonal birth control. We need to look at some other options. And I had been having migraines sometimes every day. So shout out to that provider. They just listened, and that was a great experience for me. So I did that storytelling opportunity to talk about my journey with postpartum hormonal imbalance and postpartum depression and anxiety. And there were other members of that group who also talked about substance abuse, trauma. They talked about having anxiety. You also had some people on the team who talked about being bipolar. It was just a wonderful, wonderful show. So if anyone ever is interested in hearing those storytelling productions, just look up I Am Brave on YouTube. They go from city to city across the country doing these projects to bring awareness to mental health. And most recently, actually, this past Saturday, my church in Durham, First Calvary Baptist Church, they are starting up a mental health ministry. So I went to that meeting, and it was just amazing at how they're looking to address mental health in the community. And it's not just the spiritual part, because the spiritual is very important, but it's also the fact that as a church, we can provide resource. We can provide prayer, we can provide worship, but also sometimes people need a little extra, and you do not want that stigma to keep your parishioners from not seeking the help that they so desperately need. And my pastor, he's absolutely wonderful, Pastor Labyrinth. He even said himself, I'm not a licensed therapist. So I want to make it so that our people have somewhere that they can go. They have the resources that they need, and not just the people that go to this church, but the community. The church was built in the 1800s, and that church has been in the West End in Durham. So it's in a major part of Durham, a major part of Black Durham, where we want to continue to embrace people in the community and make sure that they have access to the things that they need. Because one thing in public health, everything is connected to everything. Where you live, the water you drink, the chemicals you're breathing in the air outside, the food that you have access to. I grew up in East Durham. We know what the village looks like when it comes to food access. I didn't know until I got into public health, and I tell people this all the time, that I lived in a food desert. Because you have Church's Chicken, Subway, McDonald's, liquor store, pawn shop, etc., etc. You're not going to get the same quality produce as someone who's going to a farmer's market or a Whole Foods or maybe a Harris Teeter. And
That Church's
sometimes
chicken okra is banging now.
it is. It is.
I know you're serious. All jokes aside, I'm so sorry. You said produce, and I was like, wait a minute. That okra, though. Hey, I'm sorry, though, but I'm
And the
sorry. That
Italian
I should not have
pizzeria is
said
good
that.
too. That's still my spot. Italian pizzeria is still my spot. But at the
Yeah, yeah,
same
yeah.
time,
But stop. That joke gave me an opportunity to slow you down for a second. What's a food desert?
so a food desert is basically where the people living in that area do not have access to healthy food. So basically, if you can't walk, you're in a food desert. Or if you don't have transportation like a bus system, or you don't have vehicles in this area, it's a food desert. Or, you know, you look at the village and you've got that grocery store a little bit further up the street. Now that does take care of the people who can ride the bus, and, and the people who have a vehicle or someone to take them. It's gonna leave out people who do not have vehicles, or people who have disabilities, and riding the bus is just, it's not the best thing for them, because sometimes just being at some of these bus stops aren't as accessible. You're starting to see more bus stops have a place to sit under if it rains,
Like a shelter,
nicer
like a bus
seating,
stop
yeah, like a
shelter. Yeah,
shelter,
yeah.
nicer seating. But you also have to think about, and this is part of public health and urban planning, they're making sure that the way your residents access transportation is accessible. Because it's nice if you do have a bus stop on your street, but if you've got arthritis, if you've got plantar fasciitis in your feet, which is the super flat feet, arthritis in your hips, and you've got to walk to the bus stop, you now live in a food desert, because you might need some things, but you've got to wait until, you can get a ride this Saturday to get fruits and vegetables, because you're just in too much pain to walk to that bus stop.
And and there are so many topics that you just covered just now. I didn't anticipate any of this, when I texted you and said, "Could you be a guest on the show?" I mean, I thought that we were just going to talk about infectious diseases because that's my thing to talk about. But having you on, I quickly start realizing how big community health is, how big public health is. And when you were talking about everything is connected, I feel like it's ironic when you talk about words like immunity, community, that word unity is in there. And that really kind of highlights the fact that like everything is connected. I want to go back to something else that you said because I just think this is interesting, and we're gonna end up running out of time, and I'm gonna have to have you back because there were just so many things that you talked about. But one of the things that was interesting, and shout out First Calvary Baptist Church. I've been there a handful of times. Um, what is it like working through the faith-based community in regards to community health? And the faith-based community is a broad and diverse community. So, what has that experience been like, and what are some kind of I don't know, lessons learned as you have, even though you are of the community, right? If you are raised in the church or of that community, but still you're probably learning some things about the community that you may not have known before. So what has that experience been like, and what have been some lessons that you've learned from that work?
I would say to anybody that's working with people, whether you're working in social services doing eligibility, whether you're working if you're working with people in general, you could be working somewhere and you're taking returns for items. It doesn't matter. It's this poem called The Other Side of the Desk. And it talks about how you empathize with people who are on the other side of the desk and that you could easily be in their shoes. And that's one thing I learned about working with HIV. Like I said, this all goes together. It can be you because viruses, bacteria, they don't pick and choose who they want. So one thing that I learned is that when you're working with people from a different background from you, they may be people who are vulnerable at that moment, people who are unhoused. They're not homeless, they're just unhoused. You know, homeless, we're saying homelessness, but these are people that are unhoused. You have people who are of different faiths, of different racial backgrounds, age, generations, you know, things like that. Also, insensitivity far as if someone has a disability or not. Not all disabilities can be seen. So you're dealing with people who have different things going on. So you cannot just approach communities or people and you're just like, I've got this for you. This is what I plan for you. This is what I want for you. I did this and I'm giving it to you. You're welcome, you know, and that's not going to work when you're going into a community. For one, you have to do your research. You need to know about the people that you're going to interact with, the community that you're going to interact with. And then when I mean research, I mean the good, the bad, and the ugly, because you may be wondering why this organization doesn't want to partner with your major corporation, but you didn't research the history and you all may have not yet taken accountability for what you've done to this community. And it can be something as simple as saying, we're going to put a playground out here for y'all and blah, 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 blah. And you're looking at the community like, oh, we put this nice playground out here for y'all. You know, why are you upset? And it's just like, well, because all we've been asking for is for you to remove this one dangerous piece of equipment in this certain neighborhood's playground, and you all won't respond, even though all these kids are getting hurt. You know, that's just an example because you didn't listen to them. And I think the same thing happened with Mpox, the Mpox outbreak that happened. When the vaccine came out, you saw high rates of men who identified as white who were vaccinated. They got vaccinated. It's the same thing that you see with PrEP, a high rate of use of PrEP, but we did not see a lot of vaccination rate or high vaccination rates among African American men, men who had sex with men at the time. But you have to think about the fact that if if you don't go out into the community where people are the most vulnerable or they're most at risk, and you keep your marketing and your communication and your efforts within the same places that they've been in, you're missing out on a huge opportunity for the community to give you the jewels that you need and the gems that you need to be successful. And anytime that you're doing community work, it should not be get in, do what you got to do, and get out. You want to make sure that these are long-standing relationships and that you're not just creating relationships just to say that you have them. It's nothing wrong with a check-in. Even if you don't have anything to give, even if there's nothing to do at the moment, it's nothing to check in, because you might not have the grant money right then, but you've got a friend over here at this organization, they have some. You know, especially if you know that the people that you're working with, they need the food pantries, they need the bus vouchers, you know, they need the giving closet or the clothing closet. So it's all about making sure that you share and you communicate. But I think that going into any community, especially if it's not your community and it's not your people, you want to make sure you take the time to do your research and you don't go in and assume anything. That's their story. They know themselves, they know their people, and they know what they need. So it's very important to go in with an open ear and also an open heart, so that you all can work towards solutions and also things that are long standing together.
Mm. And this is Alonza Pamplin, expert public health, contributor to public health in a wide variety of ways that you've heard right here, and now a community health consultant with UNC Health. You're absolutely right. That there's a part in there like empathy and really kind of understanding that has been a through line in what you've said. I mean, at first you were talking about your entry into public health and to your passion for HIV was this direct connection. That level of empathy drove you, and then there's this appreciation and understanding that you approach a lot of this work with uh, from this kind of standpoint of the understanding of like the other side of the desk and really knowing what it's like to sit in someone else's seat or walk in someone else's shoes. I mean, that is absolutely critical and crucial. I mean, that was absolutely huge. What happens for me is that I get a chance and privilege to talk to the most incredible minds around. And it's this is all a podcast, but like I'm the one I feel like who benefits greatly from it because just you're amazing, the guest's amazing. It's just always incredible. But what happens is that this is not scripted. I don't have any notes. It's just freestyle. And so after it's all over with, sometimes I kick myself because I didn't ask the right question. I'm like, how could I have had this person on and didn't ask them about X or didn't ask them about Y, right? So I actually wanted to just take a step back and ask you, when you were coming on today and thinking about what you wanted to talk about, you may have prepared yourself to receive a question that you didn't hear from me. And I apologize. As my pastor says at St. Joseph CME in Chapel Hill, North Carolina, charge it to my head and not my heart. I know a lot of people say that, but yeah, I know my pastor. So charge it to my head, not my heart, if I didn't ask the right question. But I wanted to turn the table now, right? Other side of the desk, right? Put you in the shoes of myself. Like, what questions should I have asked you that I didn't get a chance to ask you or you didn't hear? And then, yeah, go ahead and answer. This is your opportunity to like talk about that thing that I might have missed. So yeah, Alonzo.
Okay. I would say I got two things. So the first thing is networking. I'm a networking nightmare. When you saw me practicing for my presentation, I have to practice because even when I'm talking, I'll go back and I'll look at something that I was doing and I fumbled my words and I'm just like, oh, I just can't get it right. Like I've just got this thing about, I don't know, being out front. I like being in the back. But I think that people have to understand when it comes to networking is a skill. If you don't have it, you can learn it. You're going to have to put yourself in some uncomfortable situations, especially if you are a person who may be a little withdrawn or introverted. You haven't had a lot of opportunities to just introduce yourself to people. So, you may have to take that outgoing friend or coworker or teammate with you to an event to watch them and see how they interact with other people to develop those skills. I'm just now learning that. I'm just now getting into that. And I was one of those people that I would get so nervous with people I would not follow up. It just was not there. And another key to that is also making sure that the networking is intentional and that what you are wanting from someone, you might not have it to give to them. They might be somebody who's got their doctorate, they've been in the game for 50 years. You might not think you have a lot of, gems to give them, but there's gonna be a time in your life where you meet someone who you can turn around and you can give something to them. So you don't want to be climbing up and then you don't ever reach back for other people. So that's that. And then the second thing I would say is, how do you balance life? We've seen each other at gymnastics class as well. So I think that it's really important that people make sure you take time for what's important for you. And when I'm saying for you, I'm saying outside of being a parent, outside of being a student, you've got church, you've got your societies and your different extracurriculars or volunteer things that you're into. If you got kids, once they get a certain age, it's always something. They've got a party, they got a class, they got something, but you've got to find time for you, because if you have reached a point where you are burnt out, or you may be not in such a great place mentally, remember that you may be not only, hurting yourself, but also hurting the work that you do. And if you're in a community like I am, or you're working in infectious disease or working with patients who may be sick, that's a lot. Interacting with people all the time is a lot, and it's a toll on you. So you've got to have your plan, whatever it is. If it's working out, if it's reading, if it's just saying like, I'm that 15-minute, don't talk to me, nothing, wherever you've got to do it, just find that thing that you need so that you can keep balance, because it's so important to public health workers, healthcare workers. I mean, anybody. I'm not going to take it away from anybody else, but working in community, especially during this time, especially what's going on with public health, what's going on with science and education, you have to make sure that you take care of yourself so that you can continue to do the work, and not only do the work, but do good work so that we can actually serve and help people.
Man, shame on me for not giving you that platform to say that earlier. What I heard was networking, and taking good care of yourself so you can do that good work. Yeah, yeah, that's absolutely huge. Alonza, thank you so much. Case in point, I am glad that I love networking. I am glad that I stopped by this lowly, sad soul in a dimly lit, empty conference room practicing her presentation, because I would have never imagined 10 years later that I would need your help on so many different instances. So I'm glad that I stopped by. and,
I'm
and
glad you did too.
that that has been an interaction that has been beneficial almost over a decade now.
Yes.
Well, with that being said, from the bottom of my heart, I want to first thank you for coming on the show, right? That's the first thank you. The second thank you is for being an amazing person. The third thank you is for your service to the community and to the world. We're all grateful to have you doing the work that you do. And obviously, anytime you need help, assistance, a partner, whatever, hit me up. Span is here to support you, the community, anything that you need. But with that being said, Alonza, thank you so much for joining us today.
All right. Thank you. Y'all have a good one.